knowledge and behavior are not separate, and knowledge as the basis for truth, and truth as the basis for joy. Thank you so much for weaving it together. The joy that we're talking about is obviously to be experienced in our physical, emotional, psychological selves, and that is the science of Ayurveda. And now I hand it over to Shri Rajeev Vasudevan to give his opening remarks, and you can make the presentation, sir.
I'm honored to be amongst the most, to be amidst the most learned of Indians, right on the stage and in front of me. Also, when, I first of all want to express my gratitude to IIT Delhi, Professor Nomesh Bolia, Shri Ram Gupta, and all the stakeholders who make it possible for me to be before you today. The subject assigned to me was to talk about health and well-being, and it is therefore very important to look at in a contemporary sense. How does So when you look at this entire subject, we should quickly understand in a global perspective, in a regional, national perspective, and I know we have the benefit of a very eminent economist come policymaker in Dr. Rajeev Kumar here, who has been party to most of these deliberations. But quickly going, if you look at the fact, over the last few years, what you see is that the global burden of disease across the world, right, all the socially developed economies of the world, the health benefits have plateaued. While people are living longer, but they're living with disability. Take Japan, take USA, take Europe. So what is the health and well-being that we see as a definition, the goal that we want to go to? I should do that, okay. So look at disease, right? When we imagine that, 40s or 50s, we develop hypertension, the process of disease has started 35 years back. Great, thanks. Yeah, so take this for example. We are talking about health and well-being of society, of India as a society. We have today more pre-diabetics than diabetics. And the data, government published data, 55% of pre-diabetics will become diabetics. India is soon going to be the diabetes capital, or probably already is taking over from China, right? So the fact, what we need to understand here, 5 to 7 to 10 years before I am diagnosed as being diabetic, I am already got my insulin resistance to have peaked, which means the disease has already occurred and gone by the time I do. So how we Indians, the most educated Indians, and even when we go to an endocrinologist, we confuse symptoms of a disease with a disease. The disease is something and the symptom is different. So this is a very basic misunderstanding that prevails. Therefore, why I want to bring this up, when you look at healthcare and well-being, it is, I would say, not a misnomer, but a misunderstood normer. It means different things to different people. It's best seen not from the point of view of primary, secondary, tertiary, quaternary healthcare, but to look at it from the eyes of the healthcare consumer, individuals like you and me. So, when you look at prevention, why we look at it from a preventive healthcare lens, you're talking about primal prevention, what you do with the health of an expectant mother, how to conceive, what is the best time to conceive, how to have both the male and the female in a position to conceive a best progeny. There is a complete vidhi to it. And then once you conceive, how to ensure that the child yet to be born. And my premise, which I've been telling for quite a few years, we are producing generations of under-potential Indians because we are so focused on parameters like infant mortality, maternal mortality. We don't look at health, right? How many underweight children today and stunted growth children across the country, right? So we need to re-examine what are the parameters we measure. You go to primary prevention, this is classical preventive care. We look at executive health checkups, medical checkups we do annually every year, but we think and we forget about it. But can we nip in the bud? So when both these primal and primary prevention fail, you get to what is called secondary prevention, which is nipping in the bud. Why I want to bring this up, the red circle in the middle is only 1/3 of healthcare demand. The prevention of a non-communicable disease from evolving into a full-fledged acute emergency or rehabilitation thereafter constitutes, with the earlier part, constitutes 2/3 of healthcare demand. And people die, 2/3 of people die before and after. But the entire focus is on including insurance and the government funding. it's there in Ayushman, you have primary health wellness centers, but is on the acute emergency care. This leads to a misplaced emphasis on what is health of society, right? And we need to look at promotive care, which is really enhancing the potential of a person. So I won't go into the details, but quickly to say there's a continuum of care. And we tend to forget that at every stage, there is an opportunity to identify latent emerging risks, nip in the bud, and also look at positive health. So the other part which is missing, if you were to go and look for multi-morbidity and search in journals across the world, you will find very few papers. But 76% of US healthcare spend goes into people with 5 or more chronic diseases. Okay? In India, if you were to look at it, about 60% of the people who come to our chain of hospitals have multiple morbidities. But we are so focused on single disease, we forget that people have multiple problems. And do we have a system which treats the rogi in whom the roga is there as opposed to treating roga, individual rogas? So we need to understand that a fact that this data over 20,000 patients, what it reveals that 66% had 3 or more functional health issues: impaired sleep, impaired digestion, bowel movement, and mental health. 46% have either, of 20,000 people, have either depression or anxiety related symptoms. So 82% have at least 2 or more functional health issues. So these are progenitors or predictors of eventual disease today. So we need to look at what we can do. And the fact, and this is a paper from Nature, which says that, and there is a very interesting a site called the numbers needed for treatment to establish efficacy. This is from that, it has shown this data. In the US, the top 10 selling medicines, and before we go and follow blindly another paradigm, for every one drug patient who benefits from a medicine, 3 to 24 people do not benefit. This is published data. So where are we talking in terms of what is cutting edge and precision and the rest of that? So therefore, we come to a paradigm of Ayurveda, which is truly the most evolved systems thinking applied to whole person health. What is systems? Many of you would have studied system. You define a system boundary. You have an endosystem. You have an exosystem. The exosystem is dynamic. And the beauty of Ayurveda, it establishes a relationship between a dynamically changing internal system, if I define my body and mind and spirit, if you wish, to be my system, and everything around me that influences me. How do I maintain in a many-to-many cause-effect scenario? We are so got used to health being a single cause, single effect model, we don't realize the effects in turn become causes for something else. So if I look at systems thinking, and we are so focused on genomics and genetics, the number of diseases can actually help to prevent are not even on, so discrete and few. But health is not to be limited and constrained to that. And Indians need not follow blindly what others do, spend, and not benefit from. So my genetic profile is my health potential, not laid down in stone. My diet lifestyle at a particular place, particular time with a health history. Why I bring this up? Ultimate systems thinking, fuzzy logic, complex systems biology. If you really want to take it, Ayurveda summarizes beautifully in this manner, right? And therefore the concept of homeostasis. Why I bring it up? The state of good health, what WHO defined very, very, very superficially in 1976, what Ayurveda acharyas told about 1000 BC, right? 600 BC, Sushruta Samhita, I'll come to that. But what the French physiologist defined, right, and which is put into English as a definition, that homeostasis is how a person preserves naturally internal balance. In the way I put it, external stressors, how a human being is able to restore homeostasis. So the state of good health is not that I have a particular BMI or a BP or something. It is my ability to restore homeostasis. So I'm feeling good in Delhi, I go to Bangalore, and immediately I fall ill. I'm not healthy. So very often I'm in a very unstable equilibrium in a particular place. My ability to restore stability in my system, that is good health as Ayurveda goes. As defined by Sushruta, very beautiful shloka, complete. I put that into English. Samadosha, Samagnischa, Samadhatu, Malakriya, Prasanna, Atma, Indriya, Manaha. Such a person is swastha, right? So he has swasthya. And the point that Professor Sampadananda talked about, utsaha, right? So I didn't bring in urja utsaha, right? Energy, vitality, and enthusiasm, right? That whole thing is about a positive spirit. So what I wanted to bring in is that Ayurveda goes beyond just a particular physical thing. It's about that positive spirit. And therefore, a mainstream complementary system of care where it can work to enhance and give India, as I often say, a Brahmastra between Ayurveda, yoga, combining with modern medicine. It completes the value chain very affordably. So there was a point that Professor Nomesh said, does it make it more affordable? I will say it makes it more affordable, more accessible, and more acceptable. It's completely aligned to the culture of the society. So quickly, because we are in IKS, I just want to show that these knowledge systems that we are all talking about are not discrete and disparate. They all evolve from the same fertile bed or soil. They're all interconnected. So when we talk about yoga or we talk about the education or Vedanta or Sankhya, yoga, all of these spring from the same thing. And therefore, it allows us such richness. We don't need to separate. We need to align. So from a point of view of IKS at IIT Delhi, there is a synthesis which is possible. So what is Ayu? Ayu is not living long. It is living to self-actualize. So if I say that, the Ashtanga Yoga allows you to go to Samadhi, right? Ayurveda in one sense is enabling you to get to a point. So you say Yama Niyama, along with that, the knowledge of how to lead to this self-actualization in the totality of life. Veda, why I want to bring it beyond the oft understood meaning, Bhava Prakasha, some centuries back, said that helps you to understand, preserve life, and to align desire, knowledge, action. So when we talk about Vyavahara or Pravachana and so on, the practice in one's own life, it tells you how to align discrimination, Dhi-Dhriti Smriti, in a way that my consciousness is awakened. A full framework of Trisutra which is there. And all of this is experiential. Why I bring this up, it is not based on 200 years of very limited superficial science and codes. It is and Ayurveda is not 600 BC. It is the culmination of accumulated knowledge of people of this part of the world since the beginning of time. So when you say Brahma gave it to Ashwins and Ashwins gave it to Indra, that does not mean that Brahma physically told. It means it's from the beginning of time, the accumulated knowledge of the people of this world. So you have tested completely. It's been tested and refined over millennia. So these are examples here. And the fact that Ayurveda is told, you have to look at it in a Trividya Shishya Buddhihitam, which means it has to be understandable to different levels of understanding. So you can bring in Ayurveda at a very layman level, at a scholar level, and at the principal level. And the fact there are techniques to decipher, and all of this is part of the Ayurveda knowledge framework. The Parikshas, right? And why I bring this up, when I came into Ayurveda about 20 years back, I'm a mechanical engineer by training, right? And done my management thereafter. So if you look at the fact that Parikshas, mostly you hear this thing called Nadi Pariksha, something. I don't want to get into the pros and cons of that. But Ayurveda is much, much, much richer, much more scientific, heuristic, rational in the way it goes. So Trivida Pariksha is Darshana, Sparshana, Prashna. Panchendriya is by the 5 senses. You examine the Roga, you examine the Rogi. There's anthropometry very clearly done. I mean, it's quite amazing that in those days they could see patterns which would come, which are exemplifying who is a healthy person, who is not a healthy person. Establish inferential relationships that are exclusive, consistent, and inseparable. Ayurveda in your process of diagnosis conjoins you. And let's understand, millennia back, a Vaidya was not a doctor. A Vaidya was the wisest man in that community. He would advise the king, right? Because if the king is healthy, the praja is healthy. So this is not to be confused with allopathy, this pati, that pati. This is about making a healthy, self-fulfilled society. And the ruling out chance factors, how to make it absolutely logical. And I invite all the technical people here also. You come into Ayurveda, you'll be so surprised by the elegance and the rationale, right? Where people try to make it mystical. It is the most rational science you can imagine. Disease causation. Look at it where we have a pathogen-led disease model. We are talking about suppression of natural urges. The most beautiful, Vegodharana, there are 13 natural urges. How that can lead to disease. You look at PCOD, you look at many of those conditions come from suppression of natural urges in one sense over the years, or UTIs and other things. You look at Asatmi Indriyartha Samyoga. The fundamental basis of disease is inappropriate perception or you begin from desire. So the unhealthy perception process leads to disease. This is how it is told. Raga di roga. All diseases spring. The first sloka of Ashtanga Hridaya talks about raga di roga. Roga comes from raga. And prajna parada. Just see the beauty of it. When I do something contrary to my conscience, I am creating the process of disease and leads to tridosha utklesha. So the fact that rajas tamas goes up, I want to bring this point, what you bring as Vedanta or you bring as in Patanjali Yoga Sutra as the mind and the spirit, Ayurveda also brings that into the health space. Nidana Panchaka, Adharma, Avidya, all of this are stated. Okay, we won't have time to go into detail. The treatments are rational, pratyaksha, anumana, aptopadesha, yukti, which means if I go towards prescribing something, rational prescription would emerge from what you see, pratyaksham, what you examine, then anumanam, that is inference, and you link it to the body of knowledge which is already there, and then you lead to a rational prescription of care. And then you have other forms which are equally important in a world today where people are beset with mental and spiritual crisis. So the intervention is personalized diet, lifestyle, counseling, medicine, treatment, depending on the stage of the disease. Many diseases, just by altering the diet and lifestyle, will go away. You don't need medicines for most of the things. More often than not, people for 10 years, 15 years struggle. And you'll be quite surprised if you go to a good Vaidya, he'll tell you, just stop this and that. And normally young people don't even have to think of antibiotics. We have this paradigm of the viral, I had a viral fever or I had a bacterial fever, or I take antibiotics without even knowing whether I have a bacterial fever. Most often it comes from the stomach, right? Ama coming collected. So there are so many things which are here. I just want to show you quickly a process of establishing, this is the culmination of maybe 1 hour of consultation, where the Nidana Panchaka, that is a 5-fold disease causation, right? Nidana Panchaka, Ahar, Vihar, Manasika, Agantuja, and Nidana Arthakara, comorbidities, leads to this disease tree which establishes the connection from my basic behaviors to the disease symptoms. And how for 3 diabetics, completely different disease trees. Why I bring it up, go to the American Association of Clinical Endocrinologists and see that algorithm. If your HbA1c is between this and this, you'll be given monotherapy. Then if it doesn't correct within 3 months, dual therapy, then triple, then insulin, right? Here is a completely personalized thing and radical outcomes that you can see, right? It is impossible to imagine that you can get these outcomes leading to, I mean, I'll just mention this, the health and well-being also concurrently established with patient-reported outcomes, and over time you can see multiple people. Why I bring this up, Ayurveda is not this very superficial thing, much more. So as I conclude, there is one very important facet which is emerging, which we believe is something that allows India to separate itself from the world, integrative management. In many of the conditions which is acute emergency care, Ayurveda today, as we speak, works with ICU patients, works with the neurosurgery department, and then ultimately hands over. It comes initially as adjuvant care, then Ayurveda takes over, and together, and why I bring this up, it is not showing disrespect for one or the other system. It's working together in the best interest of the patient. This is something India will attract, because if you look at the most wealthy nations, people from those countries come to India for Ayurveda and yoga, right? Not for modern medicine care. So this is something we can make into a Brahmastra. My penultimate slide is, when you look at public health, right? Today, doctors are not willing to go to rural areas. If we have to create, and the push of the government, and I'm not going to take too much time, what you do at a wellness center today can be tremendously strengthened, because Ayurveda focuses on health management at the first level, which is local, regional, culturally specific. You're able to look at protocol-driven risk assessments, and this is where technologies can come to play, Ayurveda-based and integrated risk assessment questionnaires, symptom management at that level, also the very clear algorithm-driven escalation referral, if required, to other centers, and this in a grid like the Ayush grid or the ABDM, where the continuity of data is maintained. So this ensures a smooth, seamless thing, ensuring accessibility as well as affordability. And overall today, why I want to bring up this last slide is, all the enabling factors are there. What we need is more capable Indians to realize that there is a very great opportunity to get into any type of entrepreneurship, any type of enablement, and most importantly, looking at public health systems from the point of view of life cycle health management of society. Not getting so much into pathogenesis, but getting into, you health, not into dishealth, but into you health. So Ayurveda clearly enjoins, or the Shastras enjoins, that Ayurveda is a means to a healthy life and a long life, and this tells you everything. I'll be happy to take questions. Thank you, and thank you very much.